Hey guys, I'm Trent Carlson, and the topic I'm going to be looking at is factors impacting infant mortality rates. So, for my research question, what I'm looking at is what factors impact infant mortality rates between developed and developing countries and between genders in those countries. So, for the importance and relationship to my country study diary, I feel like this topic is important because children are the future of the world. For example, China and Japan have an increasing average age of their workforce because people do not have many children. This forces them to work more, and it also bumps up the age of retirement. And so this can relate to developing countries because if the infant mortality rate gets too high, then their workforce will get older because kids do not live to a working age, and this can hurt the country and can cause them to slow their development. Another reason is if children have higher chances of living, and this shows that a country is becoming more developed. This can be due to better healthcare, better nutrition available to everyone, or their doctors that have better education on childbirth. And if more children are living to older ages, this can allow the country to focus on other issues, like education, for example. And if they focus their attention on uh, getting getting children more education, this will give their kids a better chance at becoming specialized in better jobs, and so this can help their country become even more developed. So, in my country study diary, kind of looks at the different levels of development in the countries, and it shows that they have very different infant mortality rates. So the two at the bottom are the United States and Japan, and we can see that um, they are very developed countries, so their infant mortality rates are very low. They're even still decreasing. Peru, which is the blue one in the middle, it is starting to become a developed country, and we can see that it has decreased quite a bit, and it is starting to get closer to the level of the United States, but it's not quite there yet. And for Senegal, it's a developing country, it's very poor. In Africa, the infant mortality rate is still really high at 42%. But the good thing is that the infant mortality rate is decreasing in every country. So then for my literature review, I have the first one is by Janine Jason, Philip Nyberg, and James Marks. So what they do is they look at how kids are fed in parts of the world and how that impacts the health of a child. So they look at different types of how different ways people feed their babies and how this relates to different levels of diseases that can affect the baby. So infant mortality rate also reflects differences in the sanitation, nutrition, housing, and a few other factors of the socioeconomic status. Next one is by Carl Otto et al. So what they do is they take 5 socioeconomic factors, which are public spending on health, GNI per capita, the poverty rate, income inequality, and young female illiteracy, and find that the income level that a country has determines what factors are the most important. So high income countries that are not affected by any of these factors. Middle income countries are impacted by the income inequality, and the low income countries are mostly affected by female illiteracy and the GNI per capita. And next is Shea Rootstein, and he also looks at 5 factors that can be used to explain trends in infant mortality rates. And these are the fertility behavior, nutritional status, breastfeeding and infant feeding, the use of health services by mothers, and the environmental health conditions, and the socioeconomic status. And she determines that countries that have large decreases in mortality rates have substantial improvements in these 5 factors. And lastly is Kanafus and Edward Crumshaw. And so they state that newborn girls are biologically advantaged in surviving to their first birthday. So naturally, males should have a higher infant mortality rate. But what they look at are a few cases where mortality differentials arise from social or behavioral factors reflecting deliberate discrimination in favor of boys over girls. And this results in the male to female ratios being higher than they should be. Their study of developed and developing countries uses macro-social theories like gender perspectives, human ecology, and modernization theory to predict gender differentials in infant mortality. They find that human ecology and modernization theory have strong evidence to predict gender differentials, while gender perspectives have mixed evidence. So some of the changes made and the future research I would like to do. As my peers pointed out, I had forgotten to add a gender component, so I added that in. It's my last resource I found. Um, I also changed the countries that I was looking at in my area of study. First, I looked at mostly just African countries, specifically Senegal, and they suggested that I brought in my research to maybe just less developed countries overall, and they also suggested that I compare it to developed countries. So I added that in there too. And for future research, I would like to look at the nutrition of women in developed versus developing countries and how this really affects infant mortality rates to see if this is one of the biggest factors. And I also want to look at what countries do to prevent infant deaths, whether this is related to healthcare or they have certain government policies put in place that allow kids to get like shots or healthcare that they need. Thank you.